Hey guys, thank you for being here tonight. I appreciate it. One of the big things, obviously, that we always talk about is your engagement. I want to say thank you for being here. Uh, we do these at 6:30 usually, and but since we don't have patients coming in between 6:30, I always start earlier. So for those of you who get on at 6:30, just look back for the few, you might have missed a few minutes of the workshop from the beginning. So having said that, I want to say thank you. One of the biggest, one of the biggest things right now is trying to keep a sense of normalcy and continuing to learn as we go through all these processes that are coming out. The only thing that's out there that is really truly a constant is the change that's going on. Do I wear a mask? Don't I wear a mask? Do I follow this protocol? Do I follow CDC? Do I follow the WHO? So much uncertainty, and within that uncertainty, what you can do is you can create certainty within yourself. What are you doing to take care of your health? What is it that is important enough for you to take care of yourself? What is it that you are following? Are you following just a dogma of stuff that is a belief and not really based on fact and truth, or is it something that you are actually looking at the numbers and learning from there? And having said that, there's an importance to understanding how to take care of your body and the things that you look at and the things that come about and the studies that are there. You can talk about randomized clinical control studies or randomized controlled data, or RCTs as they call them, or you can talk about clinical trials. A lot of the times the clinical trials are where you see the true fact of everything going on, although the randomized clinical trials are important to start the process. So, it takes years for that stuff to come out. So we're going to be in this together. I want to say thank you for being here. I am with you. We are always here to help you, answer your questions, and my hope is that you see it in your heart to have people get checked for chiropractic and understanding the importance of why you should get checked from a young age. And that brings me to my topic today. It's about children and chiropractic. One of the major components of everything that goes on here is, people come in and they're already in dire straits and they don't even know it. There are people that will have a cancer or heart disease. They're not aware of it. It takes years and years to build that up. So what we're trying to do is help you to achieve good habits from a young age and teach those that that don't know what you know, on getting their children checked, getting people checked from birth. The birthing process. A few weeks ago, I did a workshop on chiropractic for all ages, and we talked a little bit about the birthing process and how it is effectively a traumatic process to both mother and child. And that's an important thing to understand, because as we move on in our lives, there's an old saying, as the twig is bent, so grows the tree. That's how your body starts to see the world. Your scope, your understanding of the world is seen through maybe a distorted view through the nervous system. So we need to make sure that nervous system is clear and that the subluxations that are interfering with your health are taken care of. And understanding always that all healing takes time. It's a process. So having said that, I'd like to introduce this slideshow to you. Now, if you can't see it, I'm going to turn back and read some of the stuff. But you can always, when we start opening up the doors to have more people here for our workshops, we'd like to encourage you to come in and engage, because I learn as much from you guys being here or looking at these, and I'm always asking for feedback. So please don't be afraid to have that feedback. And, invite your friends to watch. Invite them to come in, get checked. Invite them to just watch you get adjusted. And that sometimes can be scary unto itself, but it's an important factor in everything that goes on. So children in chiropractic, why is it important? Well, when we look at it in 1969, Abraham Tobin did some studies and went through some factors, and he found he was in the Department of Neuropathology, and he actually what he did is he conducted the study of for Harvard Medical School's Department of Neuropathology on spinal cord and brainstem injuries in newborn infants. Why is that important? Because the brainstem sits right at the base here. Okay, it's actually sort of like, not quite down to the first bone in your neck, but it's somewhere right in that area, and it puts a lot of pressure. And then when you're giving birth and the child is being born, there's a lot of stress and pull on that area. As a matter of fact, the average stress by an OBGYN can actually extend it by about a centimeter or so. And that's a lot of stretching on that spinal cord. So that spinal cord, that brainstem area can come in there. He said, and this was many, many years ago, spinal cord and brainstem injuries occur often during the process of birth, but frequently escape diagnosis, right? So that's not something that they're looking for. They're just making sure that the baby comes out and is sort of breathing, and they do the APGAR scores. They look at, which are scores measuring how active the child is, things of that nature. Respiratory depression in the newborn is a cardinal sign of such injury. Infants who survive may have lasting neurological effects reflecting primary injury, sometimes hypoxic damage, meaning lack of oxygen, or even cerebral palsy or cerebral palsy. So you have to understand that the damage can come from the birthing system, okay, from how the baby is born. It really, people think, oh, nowadays it's, many, many years later. Hasn't changed much except that we do more C-sections now, and people think, oh, that's easier. Not necessarily. I mean, there's just as much, vacuum extractions, using forceps, all that stuff is still used, and it's still very stressful on the area. But respiratory depression is a cardinal sign of that, and most of the time they don't look at those things. That's an important aspect of it, because in the brainstem area, right at the base over here, right in back here, there is a mechanism in the brainstem that actually is one that helps to regulate respiration. So if you don't get enough breath, what happens? So sometimes they don't know the cause. Do you sleep on your stomach? Do you sleep on your back? Do you sleep, there's so many different aspects looking at it, and so many different ways of saying it, and so many different, the American Academy of Pediatrics says one thing, then the next year they change. And what do they say at the beginning? The only thing that is constant is change. Okay, they're always reevaluating. They're always looking at these things. And these are the things that we have to reevaluate. So throughout this process, we have to look at what we can do to take care of our bodies, right? So those are the things that we look at. There was done in 1989. It was done by a doctor named Schneier, and it was released in the Association for Research in Chiropractic. He did a triple-blinded X-ray study, and he found that increased instability of the upper cervical spine was found in children who died of crib death. So what they did was they looked at the stability of the atlanto-occipital joint, okay, and right there, and they found that if there was instabilities in there, what ends up happening is that hypermobility can cause something to go on because it's not staying in place. So, for example, it's a Down syndrome child. It's a genetic disorder. So, do we always have a biological is there a biological attachment to everything? Is there a genetic factor to there? No, it's probably about 20-30% of the time, maybe. Majority of the time, it's a lifestyle factor in the way the baby is born, things of that nature. However, in a Down syndrome child, that's a true genetic disorder. It's trisomy 21. And in a lot of the Down syndrome children, that top bone in the neck, so the top bone in the neck looks like a ring, okay? And it sits on top of a little axial, it sits on a little pivot point, and the second bone has a pivot point on it, right? Back in here, back in here where that pivot point is, so this piece doesn't slide back. And if you can see the way my finger is moving, if this is the back and this is the front, so this piece doesn't slide back and go into the brainstem or where the spinal cord is, there's a ligament back there. And in Down syndrome children, that ligament, a lot of the times, it's not present. So there is an instability there. So you have to be very, very careful of those things that are going on. So that's a good one. T.K. Vitamin in the University of Helsinki in '87 found that the slightest hypomobility in diarthrodial joints or the facet joints could cause joint degeneration in 5 to 7 days. This is one of those studies that I quote quite a bit, because what happens is if you look at the joints of the spine, the diarthrodial joints are back here. They're the facet joints. They're back here. And this is where the brainstem sits, right on top, right in here. And you can see how a lot of this can be affected. You don't want the spinal cord to be affected in here. There's a hole that goes through here that the spinal cord travels through, and then the nerves go out from there. So basically what he's saying, that if you keep one of these joints out of alignment for 5 to 7 days, you can already have scar tissue starting to form. And it can become irreversible in 2 to 3 weeks. So that's why when we make our recommendations for care, this is one of the studies we refer to, because if it is irreversible within 2 to 3 weeks, well, that's pretty amazing, because following, if you're not getting checked on a weekly basis and you're doing every other week, you're sort of catching it, right before it becomes really bad. But if you're getting checked on a weekly basis, you can keep it from getting really bad and keep those joints from forming scar tissue. After 5 weeks, okay. Following 5 weeks of joint fixation of those joints not moving, you'll need just after 5 weeks, 18 months of care. So think about this from a childhood standpoint. If you have waited to get checked till you're 20 years old, you're behind, okay? Because it only takes 5 weeks of joint fixation, and it takes 18 months to correct it. So that's why it's important to get checked from birth and continually getting checked, so that they don't become major issues later on, okay? 18 months. So think about it. If you've had it for many, many years, how long is it going to take? You have to be the one taking care of it, and you have to be the one deciding that, hey, I've got to do something about this. Okay, I'm here to help to teach you how to do that, but ultimately you have to correct it. You have to work on making sure that these things aren't coming about. And part of that is chiropractic, yes, but also part of it is diet, part of it is exercise, part of it is mental attitude, and keeping the nervous system clear is the key to all of that. And that's where the adjustments come in. So this is an important aspect of that. So in another study, and this was in a study done in 1983, he found that mechanical trauma to the cervical spine occurred in 2 of 48 perinatal postmortems, and the traumatic damage to the cervical spine cord was fine. In this series, at least 12% of the cases from one hospital showed some degree of trauma to the cervical spine, and this was lesser than it was 20 years earlier, okay? But still, there was injury. So that's why it's important to get a qualified chiropractor to check the spine and nervous system of the child. And a lot of people, flip out because they see someone getting adjusted, and they don't realize that adjusting a child is taking your pinky, putting a little pressure on a ripe tomato and leaving a slight indentation. Or taking your pinky, closing your eyes, and putting enough pressure that you just feel it, not all the way in, but just enough so you feel it, that it's almost a little uncomfortable, but not really uncomfortable. So you can try that yourself, at home. Just put a little bit of pressure here, and that's all it takes to adjust the spine. And that's why people are like, well, it doesn't even look like you adjust them. That's true. because it's usually just a contact. You don't hear a popping or cracking or sound with it. Okay, and people associate that with it. There are some techniques that you never hear that stuff at all. So it's important to address this from birth, and that's why children should get checked. There was a study done in the safety and effectiveness of pediatric chiropractic results, and they did this with a PBRN network, a practice-based research network. This was done in this was done back in 2008, and interestingly, what they found, and a few highlights that I have here, 36 DCs reported patient improvements which were unrelated to the presenting complaint. These were improvements in patient mood, sleep, immune function, and range of motion. So there was other reasons and other things that actually showed up other than the initial complaint. And then there was a study that was in the Journal of Alternative and Complementary Medicine, and what they call, usually they call it complementary and alternative medicine, that's CAM, is what they usually call it. And they found there was a, what the study showed, this was a journal in 2010, and it actually looked at a conglomerate. It was sort of a meta-analysis almost of looking at different studies and how things worked out properly, and how things have developed over the years. And this particular article was done by the same people that did this article here, and was posted in 2008. This was presented at the convention in Brussels, and then there was a posting in here. So in this study, they found Eisenberg, who was someone quoted in this study, found that in the early 1990s, that 34% of there was a utilization of complementary and alternative medicine increased from the early 90s to the late 90s, from 34% to 42%. And chiropractic specifically. And then pediatric utilization increased from 11% to 20%. And it's interesting that out of all the chiropractic adjustments that were tabulated over those years, 8 to 11% were children. And most of the time the symptoms were gastrointestinal, respiratory, some pain, ear infections, bedwetting, hyperactivity. And you could see that it has really not a lot to do with musculoskeletal disorders. And then they go further on and they actually give percentages. And the top reason people took their children to the chiropractor was wellness-based. 16.7% out of 100 was that. And the next one was for ear, nose, throat stuff like ear infections, things of that nature. And the third was digestive. Musculoskeletal disorders was fourth on the list. So pain and musculoskeletal disorders was fourth on the list. So it's interesting that as they look through this, that a lot of the people that went didn't go because the child had pain, but had other things going on like ENT, respiratory disorders, gastrointestinal stuff. So it's important that you look at these numbers and understand that as adults, we don't have to go just because we have pain. But as a child, a lot of the times that's not why people bring in their kids. They're just looking for better health for their kids. And that's what we're looking to help you achieve, is allowing your child to have the best opportunities to process things at a better level. So those are the things that we look at. And then we've quoted this from the immune function standpoint. What Dr. Ron Perot found, he was the chief of cancer prevention research at New York's Preventative Medicine Institute at NYU in 1975. He did about 160 published reports in peer-reviewed journals, but his team measured 107 individuals who had received long-term chiropractic care. The chiropractic patients were shown to have a 200% greater immune competence than people who had not received chiropractic care, and 400% greater immune competence than people with cancer or serious disease. So what does that mean? That they're finding that by taking care of yourself and being under chiropractic care, your body is healthier over the long term. Okay, this particular study, Perot concluded, chiropractic may optimize whatever genetic abilities you have so that you can fully resist serious disease. I have never seen a group other than this show a 200% increase over normal patients. This was a long time ago. Okay? Am I saying it boosts your immune function? Mm-mm. I'm saying that the study here is saying that people had a better immune competence, meaning that their bodies responded better to things, knew how to react and adapt to things, which is part of the sign of life, is adapting, and also excretion, getting rid of some things. So it's important to understand that. Dr. Henry Windsor, what he did in 1921 was he did necropsies, I guess that's how it's pronounced, but basically autopsies. And what he did was he wanted to see if there was a connection that existed between curvatures of the spine and diseased organs. And in every situation of the 221, somewhere along the line, he found that everywhere there was a spinal misalignment, like stomach disease, for example. If there was a spinal misalignment or subluxation of T5, T9, there was stomach disease associated with it. All 8 cases with kidney, prostate, and bladder disease had the lumbar L2, L3 vertebra misaligned. So his conclusion, not mine, Dr. Windsor's conclusion, and this was in 1921, so you wonder why they didn't follow through on this, were published in the Medical Times and found in any medical library. And there was a lot of other people that also did similar studies. And his similar studies by other researchers have confirmed Dr. Windsor's conclusion that degenerated and misaligned spines have a high correlation with disease processes. This is why we talk about realigning or correcting the spine as best we can. It's easier if we start from a child because we can help them prevent. And I'll tell you, both my children have been adjusted since birth, and my older daughter had the cord wrapped around her neck twice. So we did the best we can with her neck, and it's better than it was, but she still doesn't have a good posture. She's very tall. She's 5'8", and I'm always busting on her posture, and also the tech neck and all this stuff. But we have given her the best opportunity to do better and survive at a higher rate, and to also allow her body to function at a better level. So it's important to understand that. There was a study done, and it's called The Long-Term Benefits of Chiropractic Care, and they're looking at the indication of DNA repair in serum after long-term chiropractic care. What was in conclusion there? This was done by Perot, again, in Campbell. This was done in 2005, so it's more recent. Patients under long-term chiropractic care, 52 to 312 weeks. So that's a year to 6 years, right? 5-6 years, all right? A little over 5 years. Weeks had higher levels of thiol, which is indicative of the ability of the body to repair DNA. Think of what that's saying. Repair DNA. Repair your genetic ability to heal better, genetic ability to function better. So that's amazing. Chiropractic care helps to reduce oxidative stress. And how many of us have heard the term antioxidants, vitamin C's, D's, all those things? Okay, well, chiropractic care is an antioxidant. For musculoskeletal stress disorders, it takes 2 years of regular chiropractic care in order to successfully reverse this process and to increase the serum thiol levels. That's why when I make recommendations to you guys, I'm looking at studies. 2 years just to stop and start to reverse the process. Think about it. Just think about it. How many years have you not been under care? How many years have you known somebody that has never been checked? You need to get checked. Okay, does it mean you need care? No, it means that you need to get checked and find out if there's something interfering with your health and that if you can function at a better level. It's the beginning. The evidence presented in this and clinical experiences, chiropractors should be sufficient reason why every newborn infant should be checked early after birth for evidence of trauma to the upper cervical spine and brainstem. This is the beginning. This evidence shows why we should be checking young children. And if you want more, I can give you more. But this is just the tip of the iceberg. I implore you, don't let people suffer out there. Don't let the kids suffer out there. Get them checked. Get them checked here, get them checked anywhere. I don't care. Okay. The medical doctor is not going to check them for subluxations and see if their spines are functioning at an upper level. All they're going to look at is major reflexes and say, okay, the baby's healthy. But don't you want the best for your kid? Don't you want their body to have the much oxygen and as much nerve system flow and enough integration into the body at higher levels? Look at these studies. Because if your kid isn't checked, they're not living at these levels. I thank you very much for this evening. I thank you for listening. If you just popped in and it was 6:30, just pop back out and restart the whole video because I'm going to save it right now. Thank you guys. Have a great night.